Hi everyone, my name is Kelsey Smith and I will be talking about precision and predictive medicine. So for some definitions, precision medicine is described as an emerging approach for disease treatment and prevention that takes into account individual variability in genes, environment, and lifestyle for each person. Predictive medicine is based on the use of biomarkers or phenotypic traits allowing for advanced selection of optimal effective therapy or else to minimize undesirable effects of different treatments. So the objectives for this project include using genetic information to analyze the relationship between anxiety and the medication citalopram. We also want to determine which medication has the highest success rate among patients diagnosed with anxiety out of a variety of different medications. And we also want to determine which medication has the highest success rate when the patient also has substance abuse issues. So I will create a table showing the connections between patients diagnosed with anxiety and their response to the antidepressant citalopram. Citalopram is a selective serotonin reuptake inhibitor that is used to restore the balance of a certain natural substance or serotonin in the brain. So for my findings, using the data set, I created a pivot table in Excel to compare the number of patients diagnosed with anxiety and their success when using citalopram. I highlighted every field and then selected generalized anxiety diagnosis, CIT success, and then inserted a pivot table with diagnosis in the row and success in the column. I then added CIT success to the values function and changed sum to count. From this table, we can see that 366 patients were diagnosed with anxiety and 117 found success with the medication. So to calculate the probability of success, I used the formula above using the data from the pivot table and got 0.32. You could also divide the total number of successes by the grand total, or 117 divided by 366. For the success rates, for the CIT success, again, 117 found success out of 366 with a success rate of 0.32. For BUP, 29 patients were tried at 6 found success and had a success rate of 0.21. For SER, 7 out of 26 patients found relief with a success rate of 0.27, and for VEN, 5 out of 38 patients found success with medication with a rate of 0.13. To continue with the medication success, out of 5 patients, 1 found success with CT with a rate of 0.20. And for MIRT, 3 out of 24 patients found success with a rate of 0.13, and no patients found a success with NTP. The lack of success with these medications could be attributed to a wide variety of factors. Every patient has different demographic factors such as race, gender, and education level. Socioeconomic factors also play a role in anxiety and depression, but most importantly, these patients all have different health issues and needs that cannot all be treated the same way. Comorbidities and health history are important to consider when describing medication. Because of these issues, precision and predictive medicine can transform healthcare by tailoring treatment to each patient's needs. When looking to see which medication had the most success with patients who also had substance abuse diagnosis, I went back to my original pivot table and changed the row to substance abuse diagnosis. I then added each medication to the column and value fields, changed the sum to count, and calculated the probabilities of success by dividing successes by grand totals. After assessing the success rate of each medication, BUP appears to have the most success treating anxiety among patients with a substance abuse diagnosis with a success rate of 0.38. And here are my references.